Living.
Welcome to Therapy Thursdays here on Louisiana Living. I'm Dr. Jerry Yarborough, owner and physical therapist at Physical Therapy and Balance Centers. And today we have one of our staff occupational therapists, Jennifer McCarthy, and she's going to be starting the series talking about wrist impairments. So, go ahead.
Thank you, Dr. Jerry.
Yeah.
So today we're going to start with talking about carpal tunnel syndrome. I think most people have probably heard that term, but may not necessarily know what that means, what causes it, and what some of the symptoms are. So we're going to discuss some of that today. So on the palm side of your hand, just at the wrist, there's a ligament that runs across. And underneath this ligament runs nerves that go into your hand. So in carpal tunnel syndrome, what happens is those nerves get compressed by that band. So why does this happen, or how does this happen? So there's several things that can kind of contribute to this. Unfortunately for me, being a woman, that is one of the factors that kind of makes you a little more predisposed. And some of that is because hormonal changes with pregnancy and menopause can contribute to this. Some other risk factors are repetitive type movements. We see a lot of people that spend a lot of time on the computer typing, and also anybody that does a lot of sustained gripping. So I've seen mechanics, carpenters, those kind of professions that use their hands in a sustained position throughout the day. So what are some of the symptoms of this? So the most frequent one that I see is numbness and tingling, usually in the thumb, the first finger, the middle finger, and part of the ring finger. And that's because it's the median nerve that gets compressed, and that's where the median nerve ends, is in those digits. So other symptoms can be pain, swelling, and decreased grip strength. Especially if you're trying to sustain a grip on an item or an object. So what can we do for this? So there's several things that we can do. The first thing that I recommend is to, when you're using your hands, take frequent rest breaks, and also make sure that your positioning of your hands, if you're typing, you're not in too much wrist extension or too much wrist flexion, that you're in a more neutral wrist position. If you're doing sustained gripping, again, take frequent rest breaks. Shake your hands out to kind of try and minimize some of that. So then there's some exercises that we can do. We can do what are called nerve glides, and I'm going to go ahead and demonstrate those for you. So what you're going to do is you're going to start with your fingers straight up in the air. You're going to make what we call a claw fist, and then you're going to roll down into a full fist. You're going to come back up into a claw fist, and then you're going to make a straight fist, and then you're going to come straight up in the air. I'm going to do that a couple of times for you so you can see. Claw fist, full fist, claw fist, straight and up. Claw fist, full fist, claw fist, straight and up. I recommend doing 10 of those 3 times, and I would do those a couple of times a day. Also, if you are having symptoms, that's a really good time to stop what you're doing and do those nerve glides. If that seems to be complicated and hard to remember, you can do a modified version of it. And in that, what you would do is do 10 claw fist, 10 full fist, and 10 what we call hamburger fist, because it looks like you're holding a hamburger. And that's a little bit easier than trying to remember all of those steps. So once we get some of the inflammation and some of the numbness and tingling under control, we can start with some strengthening exercises. So we use a TheraBall here at the clinic. You may not have one of these at home. Many people have a stress ball that you can use, and if you don't have one of those, most people have a towel, pillowcase, a sheet, whatever. You can curl it up, and we're gonna do full hand grasps, 3 sets of 10, and then you're also gonna do fingertip grasps, 3 sets of 10.
That is some awesome information to help our communities, guys. Again, we do this just to help you love your life and get over the impairments that you're having. So if what Jennifer has shared with you today doesn't take care of your problem for occupational therapy, you can give us a call or call your doctor, get an appointment, get a referral for occupational therapy. And we do offer that here at Physical Therapy and Balance Centers. As you know, we have 6 clinics here in the region. Give us a call. We're here to help you at any time, and we look forward to seeing you next week.
We'll have more after the break. Stay with us.